Dr. Graves joined the Budget Center in 2002 and has served as Director of Research since 2014. In this role, he oversees the Budget Center's analytical work, conducts research and analysis related to health and human services and corrections, and is the organization's lead analyst on the state and county budget processes. Thank you for joining us.
Thank you. Thank you for inviting the Budget Center to participate in this very important hearing. So what I'd like to do today, or this afternoon, is to try to maintain your interest for a few minutes in our state constitution, because I think it's important for everyone on this committee and everyone in the legislature to understand that efforts to move California toward universal coverage would entail constraints that are built in to our state constitution. So it's important to understand what those constraints are and how the state may be able to address them. So one starting point for thinking about moving toward universal coverage in California is that such coverage would very likely require tax increases. I guess you could think there would be a way that the legislature could cut here or there and use that spending, existing expenditures, to fund universal coverage. What's more likely is that a tax increase would be required. And in fact, prior estimates have shown that, for example, moving toward a single-payer system could entail a tax increase of well over $100 billion. And I believe the Legislative Analyst's Office will be substantiating that in a few moments. So tax increases are possible, as you know, as long as the legislature can muster a 2/3 vote of each chamber. But we also know that there are provisions within the Constitution that constrain the legislature's ability to raise taxes and to dedicate the revenues to particular purposes, okay, just rather than allowing them to flow into the general fund. So what I wanted to do today is to talk about a couple provisions in particular. One you are very familiar with, Proposition 98, approved by the voters in 1988, which amended Article 16, Section 8 of the state constitution, and was later amended by Prop 11 of 1990. A second provision that you're probably less familiar with, at least up until this year, and maybe last year, is Prop 4 of 1979, which added Article 13b to the state constitution, and itself was later amended both by Prop 98 as well as by Prop 111. So Article 13b essentially is the Gann limit, and I'll be getting into both of those issues in a moment. So I can happily report that I'm not going to be getting into the complexities, the mechanics, the formulas associated with the Proposition 98 minimum funding guarantee. I will just remind all of us in the room that it essentially provides a mechanism for providing each year a guaranteed level of funding to K-12 schools and community colleges, also known as K-14 education. So the key issue here related to universal health coverage is this. Would K-14 education be required to receive a portion of any tax revenues raised to fund universal coverage, even if the legislature decided to direct those revenues into a special fund rather than into the general fund? That is essentially the key question around how Proposition 98 relates to the state's efforts to achieve universal coverage. So what I want to do now is speak from this very simple graphic here to lay out some of the issues that are present in various debates around Proposition 98. So the first thing to understand is that in Article 16, Section 8, the term general fund revenues is used. The term general fund proceeds of taxes is used when talking about how the Prop 98 guarantee gets calculated each year. The Constitution does not talk specifically about special fund revenues in discussing or describing how the Prop 98 calculations are intended to be done. So there are varying interpretations of what this actually means. One interpretation, you might call it the strong interpretation, argues that because special fund revenues are not mentioned in the state constitution in the context of 98, and because general fund revenues and special fund revenues are distinct from one another, then special fund revenues would never count in calculating the Proposition 98 spending guarantee. So one example of how this could work, the legislature could pass a tax increase intended to achieve universal coverage. It could direct those revenues into a special fund, and it could permanently exclude those revenues from the calculation of the Proposition 98 guarantee each year, which would effectively mean that K-14 education would derive no financial benefit from the revenues raised to support universal coverage. So that's one view. And that view was expressed in a lawsuit very clearly by the Brown administration. It was a lawsuit that was brought in 2012 by K-12 school officials in the wake of the 2011 realignment, in which the state shifted various programs and services to the counties, along with billions of dollars in revenues that previously were general fund revenues, but were sort of reimagined as special fund revenues. That lawsuit was later moot because Proposition 30 passed in 2012, which essentially gave K-14 education back the revenues that were lost as a result of that transfer. So there was never any controlling decision that came out of that lawsuit. So that's the first interpretation there on the left. Looking down at the other box on the bottom, the one on the right, there's also another interpretation of how to think about the relationship between Proposition 98 and general fund and special fund revenues. And this interpretation sort of argues that the general fund, as used in the Constitution, should be thought of more broadly to encompass revenues that go beyond those that are deposited into the state's general fund each year by state law, as required by state law. So this interpretation shows up from time to time within the legislature. It was expressed in the Senate Appropriations Committee's analysis of Senate Bill 562, which aimed to create a single-payer system in California. So it was very clearly expressed there. It has also been implied in a number of ballot measures that have raised revenues. For example, each of the 3 ballot measures that have gone to the voters asking them to increase tobacco tax revenues in 1988, 1998, and most recently in 2016 have raised the state's excise tax on tobacco, deposited the revenues into a special fund. Didn't go to the general fund. But in each case, they felt that it would be prudent to add language to their measure that said, by the way, these are really special fund revenues. They're not please don't interpret them as general fund revenues subject to the Proposition 98 guarantee. They felt it prudent to add that language, even though they were raising an excise tax and depositing the revenues into a brand new special fund. I'm going to skip a few text slides here and go right to this one. Given the varying interpretations here, it seems to us that the state could be vulnerable to legal challenges if the legislature decided to raise taxes, deposit those dollars into a special fund, and exclude them from the Proposition 98 calculations. Now, lawmakers could attempt to dissuade litigants by adding what are called poison pills to a bill. A poison pill would essentially blow up the structure, would say if anyone sues on the basis of Proposition 98 and the state loses that lawsuit, these revenues would automatically go away. The LAO pointed out in a report released last year that there were 4 poison pills that the legislature adopted in the late 80s and early 90s when Prop 98 was relatively new, and no consequences ever came forth from them. In other words, there were never lawsuits that sort of tested whether someone would take it all the way, sue the state, and argue that the revenue should indeed be counted toward the 98 guarantee. So poison pill is one way to go. Another way to go is to simply place onto the ballot a measure that would ask California's voters to raise the revenues needed to achieve universal coverage and to exclude those revenues explicitly from the calculation of the Proposition 98 guarantee. So there may be a legislative way to address the issue, this constraint posed by these varying interpretations, but there's also maybe a more obvious way that's been used many times over the decades, which is to simply go to the voters and ask we, the people of California, to amend our Constitution in order to allow revenues raised for universal coverage to unambiguously be used for universal coverage rather than always sort of having a cloud over your head wondering, oh, someday this may be subject to Proposition 98 and we'll lose a significant portion of these revenues to another service as opposed to K-14 or as opposed to universal coverage. I'm going to skip to the next issue now, which is Proposition 4, as I mentioned, passed originally in 1979. Essentially, this is a limitation on state and local spending, and I wanted to lay out first the key issue here for you related to universal coverage, which is if the legislature increased taxes to achieve universal coverage, would these taxes essentially be so high, these new revenues, that they would cause the state to exceed its appropriations limit, what is often known as the Gann limit after one of the authors of Proposition 4 in 1979. So I've got here, hopefully, a relatively simple illustration. I'm sorry there are even 4 boxes on there and more text than I would have liked. This is my effort to sort of distill for you so I don't have to talk about this with text slides. That I'm going to skip the next 3 after this. But I just wanted everyone to sort of be on the same page of just about how the Gann limit works so that then you can use that to think about whether this would affect your efforts to move toward universal coverage in California. So the first thing that happens under the Gann limit is the state has to calculate its annual limit. Essentially, the limit is based on spending by the state of California, certain types of spending back in 1978, 79. So we're essentially setting our limit based on the disco era expenditures of California during Jerry Brown's probably his second term at that point, maybe his first term. The limit is adjusted each year for various factors such as did the population grow in California? Do we have more kids in our K-12 school system? Did our per capita personal income go up? All of those things get factored into calculating a new limit. So essentially every year you take the base where you are, you apply the adjustment factors, and you get a new base. That is your new Gann limit each year, and I believe almost all local governments in California are required to go through the same exercise each year. The second thing the state has to do is to determine the appropriations that are subject to the limit that was just calculated. So a couple important things to keep in mind here. We're talking about appropriations from what are called proceeds of taxes, tax proceeds. What are tax proceeds? There are various things that factor into proceeds of taxes. I'm just going to tell you the main one, which is revenues from the state's general taxes, the personal income tax, the sales and use tax, the corporation tax, all those biggies. For the most part, that is what the proceeds of taxes are made up by. There are other smaller sort of sources of revenues that get factored in. Okay, so you have proceeds of taxes. Your next step within this second box on the bottom is to decide which appropriations from proceeds of taxes are subject to this limit, because not all appropriations are. Based on Prop 4 and Prop 111, the state gets to take a lot of appropriations off the top. You don't count revenues that you transfer to local governments in the form of financial assistance. That counts toward their own Gann limits. You don't count anything we're doing in California because the federal government said we had to or a court said we had to. You don't count debt service. So those are the 3 major ones. There are other ones that I'm not going to get into, but the idea is the Gann limit applies to certain appropriations from tax proceeds each year. So then what do? You go to step 3, back up to the top, now we're on the right, and essentially you compare your limit to the expenditures or the appropriations that are subject to the limit. And what does the Constitution say here? It says that if during any 2-year period your expenditures or your appropriations reach your limit, any revenues remaining over that 2-year period are considered excess revenues. The Constitution says, what do you do with excess revenues coming down to step 4? Half of them go to Prop 98 in the form of additional spending, and half of them go back to the voters through through taxpayers as rebates. The legislature has the option of taking some of these revenues and saying, well, wait a minute, maybe we don't want to do that exactly. We're going to spend some of them for appropriations that are exempt from the Gann limit, right? Because I mentioned that not all appropriations apply, right, to the Gann limit. So there are some things you may be able to spend some of those revenues on, but for the most part, the automatic answer the Constitution gives is if we spend up to our limit a couple of years in a row, any revenues beyond that limit from proceeds of taxes go back to the taxpayers and go to Prop 98 in the form of additional spending. So why did I tell you all that? If you think about it, raising revenues to pay for universal coverage or expanded coverage in California would be considered proceeds of taxes and would go to services, health care, that are not specifically excluded from the Gann limit. These are all expenditures or appropriations that would be counted toward the Gann limit. Now, right now, we have, according to Governor Brown's Department of Finance, we have about $12 billion in what's called room underneath the limit. In other words, we're not at the limit, we're below the limit for the appropriations that matter. We have $12 billion in room. What if we decided to do single payer in California and we somehow got a $200 billion tax increase through the California legislature and appropriated $200 billion toward a single payer system? What you can see happening is you would, by definition, be exceeding your Gann limit because you only have about $12 billion in room. So anything that goes beyond, any appropriations from proceeds of taxes that go beyond $12 billion at this point, and the number may move around a little bit, would be considered excess revenues and would have to, according to the Constitution, go back to the taxpayers and go to additional Proposition 98 spending and could not be used for the purpose for which the revenues were raised, in other words, universal coverage. So can the legislature, if it wanted to, address this issue? And it's a similar answer to what I gave before on Prop 98. California voters are used to seeing requests to amend our state constitution. It happens every 2 years. It's going to happen again this year. The legislature could advance a constitutional amendment that not only asks voters to raise the taxes necessary to fund the system, that excludes the revenues specifically from the Prop 98 guarantee if it wanted to do so, but could also ask voters to revise the Gann limit in such a way that these new expenditures, these new appropriations would not blow past the Gann limit and be counted sort of as excess revenues not being able to be used essentially for universal coverage. So hopefully that was, I tried to make that as clear as I could. Hopefully it was, it was clear enough. I'm happy to take questions. First, I wanted to give you just a few concluding thoughts. It's that the first key point to keep in mind here is that efforts, is it Prop 98 and the Gann limit both constrain the legislature's ability to sort of enact major new program expenditures. This isn't something that applies just to universal coverage. We're talking about it in the context of universal coverage here, but if the state wanted to make substantial new investments in higher education that you see in the CSU, in affordable child care, in a range of programs and services, it would still be dealing with these types of issues. I'm bringing them up specifically because we're talking about it in the context of universal coverage. I also wanted to note that some advocates, specifically some proponents of Senate Bill 562, have asserted that the legislature could address these constitutional constraints legislatively without going to the voters, without consulting the voters. And based on our analysis of, good work the LAO has done, of our read of the state constitution, our response to that is essentially it seems very unlikely that the legislature could address the problem posed by the Gann limit legislatively without going to the voters, and that going around Prop 98 could trigger a lawsuit just based on these varying interpretations, which would put universal coverage, any new programs and services put in place on a very shaky legal foundation, which is probably not where the legislature would want to be when it's attempting to provide a range of robust services in the healthcare arena to Californians. So just the bottom line here is that asking California voters to remove these constraints would probably be a better way forward. And I'll conclude there. Thank you.